Welcome back to Studio 10.
Thank you all so much for joining us here on Studio 10 this morning. We want to talk about something very serious. Breast cancer is the second leading cause of cancer death in women, and according to the American Cancer Society, the chance that breast cancer will be responsible for a woman's death is about 1 in 36. So to break that down, the next time you're at the mall or grocery store or at work, look around. Odds are there will be at least 36 women around you, and according to those statistics, at least one of them will die from breast cancer. It's really scary when you think about it like that. Now, the positive news. There are more than 2.9 million breast cancer survivors living here in the United States. So let's keep that number growing. Dr. Jason Williams shows you his latest state-of-the-art early detection equipment at Precision Imaging. When you think about having a mammogram, you may not think of something very pleasant, but as you just saw, you guys have a very tranquil environment here at Precision Imaging. Dr. Jason Williams is with us. You decided to create such a great environment. It's like a spa.
Sure, it is. Yeah, I think most patients, when they go to the hospital, it's a very sterile feel, and I think it kind of makes them not really want to go. And so we thought to have something inviting, something that was like a spa, would really encourage the patients, particularly to do something important, such as mammograms, which with early detection being a huge factor, these patients, anything we could do to encourage them to come in and get it, we thought would be helpful.
For someone who may not have had a mammogram before, walk us through the steps.
Sure. So when the patient will come in, we have a special changing area. We've got an area where we can do bone mineral density if necessary. A lot of patients that are getting mammograms will be getting bone mineral density as well. And then they can come in here and have their mammogram. The one thing is that we want patients to know their results. We don't want to be anxious and go home and wonder for days or weeks. So we make sure to give them the results, to make sure to do everything that they need, whether they needed additional views or if they need an ultrasound, we try to get that all done in one visit.
So you guys make same-day appointments, same-day results.
Right, exactly.
No wondering, you take the stress out of it, really.
Exactly. My grandmother had breast cancer. My mother's had plenty of abnormal mammograms. I can think of all the times when they waited and didn't know, and that month of being unsure was very unsettling.
Oh yeah,
so.
Absolutely, for them, for their family, for any of their loved ones.
Yeah.
Now let's talk a little bit about this machine that we're
Sure.
standing in front of. This is something that you guys were the first to get it in this area,
Yes.
the only ones to have it in this
Yes.
area.
Because it slices through the breast, it essentially takes little pictures where we get individual slices. It gets rid of that overlapping tissue that you normally see in a standard mammogram. And it's actually been shown to increase cancer detection by 40%. We've picked up cancers as small as 4 millimeters, which is unheard of.
State-of-the-art equipment.
Yes.
Does insurance cover the mammograms?
Sure. So insurance does cover the mammograms, but it does not cover the 3D. So we decided that it was so important that we actually would not charge the patient.
How early do you need to start having mammograms?
The guidelines keep changing, but I think really the standard guideline is at age 40. Of course,
Okay.
if you have family history, then you're actually supposed to start 10 years prior to your close family relative that has history. So if your mother got breast cancer at age 45, then you should actually start having mammograms at age 35.
Let me ask you this. So let's say you have a doctor in Pensacola or a doctor in Mobile. You guys are in Gulf Shores.
Right.
Do you need to have a referral to be able to have a mammogram here?
Right. No, you don't have to have a referral. To make it easier for patients to get mammogram and to encourage screening, patients can actually refer themselves.
That is fantastic. Now you guys also do MRIs.
We do. We have the 3 Tesla MRI, which is one of the most powerful MRIs that's in use, and we're the only ones in this area to have it. Our system also has the ability where you can watch movies while you're getting your MRI. People don't like MRIs because they're loud, and so that makes it easier on the patient.
So any test that needs to be done, you guys just take the fear out of everything.
Right,
That's what
yeah.
you're really hoping to do here.
Right. We want to give a nice, calm environment so patients come here, they don't feel like they're getting medical tests. When people come in and are getting procedures like this, they're scared. They're usually sent for, a serious concern, and we want to make it as pleasant an experience as possible.
And I think you guys are doing a wonderful job of that.
Yes, so thank you. I appreciate that.
Precision Imaging is located in Gulf Shores, and just as Dr. Williams said, not only is mammography offered at Precision Imaging, but also CT scans, MRIs, as well as interventional pain management procedures. We'll have all of that contact information under the Studio 10 tab on fox10tv.com.